Earlier this month, we told you about a Georgia teenager in need of a heart transplant. He was refused by an organ transplant team for being, quote, non-compliant. We wanted rather, to know why he would have been denied a life-saving organ. Marcia Bonhart digging deeper to get the answers and who else is turned away.
This is one of the scores of organ transplant surgeries performed at University of Cincinnati Medical Center each year. Patients who are lucky enough to get these life-extending operations have already gone through extensive preparations before they get to the surgery table.
Where you have to keep all your appointments and you have to have blood work done regularly so they can keep up on your conditions.
Last year, Bobby Hagens of Jefferson Township received a new kidney and pancreas at UC Medical Center. He says the rules to get on the transplant list are grueling but fair.
I tried my best to do everything as according to what they wanted. As a lot of times it was tough.
Hagens knew he could run the risk of not being selected at all.
We actually very carefully evaluate everybody that comes through as a candidate.
Dr. Stephen Woodall is a transplant surgeon at UC Medical Center. He says the program has a responsibility to make sure each precious organ is given to someone who will take good care of it. So the transplant team there works hard with patients to help them become good candidates.
Our general philosophy is we want to transplant everybody. We want to get everybody that we can the opportunity.
According to the Virginia-based United Network for Organ Sharing, after a detailed evaluation, each patient has to understand the surgical risk and a complicated medical schedule.
And they warn you going in that we need this, 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 and this, and this, because there's a workup to getting on that list. And then if you don't follow that workup, they can say you're not compliant.
Now, what did you do before you retired?
Compliance and the new organs saved Bobby's life. Marcia Bonhart, 2 News, working for you.
And the University of Cincinnati Medical Center program has been able to transplant 10 to 15% of kidney patients who had been turned down by other programs. The team there often takes other patients who are rejected, reevaluates them, and then individually and successfully transplants them.